So in this case, on the low back adjustment, I'm gonna do a medium amount of force just to get some mobilization in this joint. Breathe out. Okay, now on your back. So the pop, the air coming out of the joint is confirmation that the joint moved, but it doesn't always indicate an effective adjustment. It's like restoration of normal joint motion is what we want. Okay, I'm gonna do some traction with my hands. Take a deep breath in. Breathe out. Good. Right there, so it's C2, C3 on her left.